Okay, thanks, Shelley. Joanne, are you there? Joanne Skillett?
Yes, I am, Louise.
Oh, hi. Joanne is an educator in our Learning Development department. And Betty Murphy with you?
Yes, she is.
Betty works with us right now in clinical consolidation for Meditech. They both worked on our 1877 line. Betty, can you talk to us about essentially the first contact that many people had with the organization when they called our 1877 line?
Yes, hi, Louise. For many people, this was their first contact with the organization. You have to remember that for all of us, it was unknown territory, especially for a lot of these patients who were phoning in. They were afraid. You could hear the fear in their voice. They were experiencing tremendous anxiety. We, on the phone lines, realized we had to instill confidence somehow in the system, why things were being done a certain way. People, you could hear it in their voices. They needed reassurance. Many times it was just simple explanations. Other times it was quite detailed, where the criteria originated from, explanations of WHO. Yes, you will receive the vaccine, however. But even though the information you were given them may not have been what they wanted to hear, it was amazing to hear the thank yous and to actually feel the appreciation in the voices of the people that phoned. They phoned us to thank us. They phoned us to thank the vaccination clinics. They phoned us to thank whomever. There were a lot of thank yous out there, but we heard it.
Okay. Joanne, how did this experience impact you?
Well, there was two parts to the telephone line. One was what Betty was just talking about, was the live one. I was on the other end where a person couldn't talk to a live person. They left a voice message. So I sat there day in and day out with the headset on, listening to everybody. And how it impacted me was, even though people were so frustrated, as Betty said, and they were really worried, they were so kind. There was very few that said anything bad on the phones. They just knew we were out there. They wanted help. And it just, I went home every day exhausted just from listening to them and then taking their messages and getting it to the people on the live, saying, please phone this one and that one. But it gave me such a sense of satisfaction because I was a part of a larger thing, and yet just listening and recording was really, really important. So it really impacted me, Louise.
So, Betty, what will you take away from this experience?
I think the most I'll take away is the knowledge that we all pulled together so quickly. The phone line team was phenomenal, but from the phone lines you could see all the other different aspects fitting together as well. You could see it from the community health perspective, allergies, home visits, the flu assessment clinic. You could just see it all fitting together. And everything all fit. It all had its own place, and I have to say it left me with a really good feeling. It was very rewarding to be part of it.
Okay, thanks, Joanne and Betty. One of the more positive stories we hear coming out of the mass immunization experience for the public was the way in which security on the sites conducted themselves. Gary, are you there? Gary Barnes?
Yes, I am, Louise. How are you?
Oh, good. Gary is our regional manager for security. Gary, can you tell us the kinds of feedback that you've gotten from the public since this pandemic?
Certainly. I guess throughout the duration of this initiative, we received at the Regional Security Office, I believe, some 37 calls from members of the general public, really complimenting the way the security officers interacted with the various people that called. Certain stories, I guess, that come to mind predominantly would be, if we all recall, there were some really cold days on the line.
Yes.
Really cold. And I believe 3 of the individuals called mentioned that the security officers actually took off their outer parka and gave it to people who were cold on the line. In addition to that, I recall that a lot of them said that they had various medical issues, whether it be certainly nothing serious, but some elderly people, etc. And the security officers would, take them back to their vehicle and so on. But generally, it was the thought I got from it, if there was any common thread, was that it was the level of interaction and the reassurance, the exchange of information that occurred, and that type of thing. So it was very refreshing, I might add, to hear those type of stories.
And usually, like many of us, you get calls for complaints and not compliments.
Yes, unfortunately, we're problem solvers by profession, but most of the time we're called after the fact when things happen. But it was very refreshing in this regard to be, on the scene, so to speak, to help everybody in a positive, more strategic way, I suppose, in providing a safe environment.
Okay, thanks, Gary.
Welcome.
It's great to hear the positive, but so many of us also recognize that there was a negative side of H1N1, and there were some people who had some very serious health situations. In the community, the public level of panic probably reached its peak in November, and Eastern Health responded by setting up places for people to be assessed. Our emergency rooms through many parts of the region were seeing double the normal volume of people that they normally would see. And in St. John's, we actually set up a flu assessment clinic outside of a hospital that, in fact, we set up and we moved and we set up again. Renee, are you there?
I am, Louise.
Renee Porter is a manager of ambulatory care in St. John's. Renee, can you tell us about the logistics involved in setting up this flu assessment clinic? We'd never done it before, and how that happened?
We hadn't done it before, and actually a lot of the planning got done. I had been away from work for a couple of months immediately prior to this happening, and I came to work one morning. When I walked in, a bunch of people were pulling at my coat saying, Elaine Warren's looking for you. She's in Joy Thompson's office. You got to go.
Okay.
Well, I didn't really participate in much of the planning, but what I can tell you is that the planning that was done was absolutely essential to how fast and how efficiently we were able to roll out those clinics. So the planning was a big piece. The other big part of it was, and the same theme you're hearing from everybody here today, was the teamwork. When I picked up the phone and asked for something, within 2 hours we got it. Naively, I think, we set up at a location on Major's Path, which, as a clinic manager, I thought, oh my gosh, we got waiting space here for 30 patients. This is going to be great. And so the first day, when in about 10 hours we saw 65, 70 patients, I was thinking, I don't know, what are we into here? Well, by the end of the second day, and I think Oscar called it, did you make reference that it was like a war zone? Well, I was calling it a MASH unit. We had people lying on the floor. We had people across chairs. We had people fainting while they were waiting to get in to be seen. We called ambulances to take patients to the emergency departments. Just absolutely overwhelming. But everybody did what we needed to do to get those patients seen. Nobody went home till every patient who had checked in that day was looked after, and we did that every day.
Absolutely. So as a manager, how has this experience impacted your work day to day?
I think the teamwork, obviously, I mean, I've worked through, I won't tell you how many years I've been in healthcare, but I've worked through a few strikes. And I always thought that working through a strike was probably the best example I'd ever seen of a group of people pulling together, stepping outside their comfort zone and doing whatever needed to be done. But I will tell you, bar none, that this flu assessment clinic and this whole pandemic response thing was by far a lot more satisfying and a huge example of teamwork. I've never seen anything like it.
Okay. Thanks, Renee. Merv, are you there? And Tammy?
Yes, I'm here.
Merv Greenham is a respiratory therapist, and Tammy Harvey is a nurse. Both of them worked with the sickest of the sickest patients we had in our ICU at the Health Sciences. So, Merv, what was it like working in ICU during those days?
First of all, I guess it was very, very busy. At the peak, we had about, I'd say, 22 to 24 ventilated patients, with probably a dozen or more of those in severe ARDS.
ARDS, for people who don't know that?
Yeah, acute respiratory distress syndrome is basically, we've had this type of patient before, but usually the most we've had is probably a couple at a time, 2 or 3 maybe. But we've never experienced the volume of patients that we had like that, right?
Yes.
The workload obviously was severely increased due to the level of care required to look after these patients, and it was very challenging to meet the needs of all the patients. I guess from an RT perspective, respiratory therapist, there's a great expectation from us by the physicians and other healthcare workers. Main patients the problem had was respiratory failure, so obviously we're the ones that were looked upon to help give advice and